grew up in Margate, New Jersey. I was born at the Atlantic City Hospital. Went to Lafayette College and Jefferson Medical College. I guess I always liked animals. And back in high school, the World War II was on. And I joined the Navy when I was 17 as a hospital corpsman in the Navy, and I was hooked. I decided medicine was for me. They were long, long, hard hours. And I think once you got in, it was persistence that got you through. They flunked out very few. You had to really be bad to flunk out. You just had to keep going. But we did. It was a very exciting time to go to medical school. Medicine was very primitive as compared to today. I graduated in 1953, and in May of 1953, our professor of surgery, Dr. John Gibbon, brought into the great amphitheater a 19-year-old woman who was the first person to survive open heart surgery on a machine he'd been working on for over a decade. So the world of cardiac surgery opened up as we finished. We all wanted to be heart surgeons. Then you got a little more realistic and we all did different things. But it was a very exciting thing. We knew we were on the dawn of something very, very new. Yeah, there's one that's very important. You've heard of laparoscopy, the belly button operation? I read about a young doctor at Johns Hopkins in 1970 who was still a resident who was teaching this down there. I took the first course. In 3 days, I learned how to do laparoscopy. Laparoscopy is a telescope inserted through by the navel, and the virtue is we had a cold light source. We didn't have the hot incandescent light bulb that could burn tissue. And with that, you could look around, you could sterilize patients and do diagnostic and eventually other surgery. I took that course. I came back and I said I wanted to do it. People said, well, go buy the tools. Hospital wasn't going to buy them. This might be another crazy idea. So I went out and spent some thousands of dollars, set the thing up, and the acting director of OB/GYN then was the Dr. Alan H. Seeger. And he put his hand on my shoulder and said, Jack, do me a favor, just don't kill anybody. I said, Alan, I'll be very careful. Well, I wanted to get trained as a generalist, and Jefferson always tried to have us think that way. And I had an old-fashioned rotating internship. The men and women today don't do that. They all go into specialties. But we went through pediatrics, pathology, medicine, and the works. And during the course of that, I decided I was very interested in gynecology and obstetrics. Not so much the obstetrics, more the gynecology, because I like the surgery, I like the endocrinology, and I like the fact that it was both a medical and a surgical specialty. I'd gotten a gynecological prize at medical school, and I went back to my professor, the late Dr. Louis Sheffey, and he said, my residency is all filled up, but he had a wonderful thing available, a fellowship with the American Cancer Society, and I got $1,000 for 12 months tax-free, and that was big money in those days. So I accepted that. One night at 2 in the morning or so, they brought in a black woman who was having a massive hemorrhage. I was called down as the OB/GYN resident to see her. I examined her, and she was going into shock. My first job was to call all the other hospitals in town, do you have any black female ward beds? No, we don't. And the nursing supervisor said, well, there are none here, you can't keep her. And I made a decision. I said, I treat disease not color. I want her admitted to this gurney. They said, you can't do that. I said, I'm doing it. Well, I got chewed out by the administrator the next day. And I said, well, that's the way I do things. And we found her a bed, and she stayed. To the credit of the hospital in those days, they were getting sensitive to changes, and we used to have 2 sets of men's room next to one another, the same with the ladies' room. And it would say, colored men, white men. And they erased the words white and colored, and after a year, they erased men on one. It became a utility closet, and then we had a bathroom. So the hospital moved along. I was allowed 6 beds to bring patients in for surgery as a resident. 3 black, 3 white. I said, this is ridiculous. Sometimes I have 6 black patients that need surgery, and no whites, or all the combinations. And the wards, the largest ward they had was 6 beds. I said, why can't I put them all in one ward? Oh, we don't do that. Well, why? We just don't do that. So I made a deal. I'll put 3 whites on one side and 3 blacks on the other side to have a curtain down the middle. Well, you know what happened. Within a few days, I got rid of the curtain. It worked out as I thought. The black patient and the white patient, they didn't care being in a bed next to each other. They were pleased to be in the hospital getting care. And that broke that barrier here in the state. And I was very proud of those little contributions. I ran a peculiar type of practice in some way because I spent a great deal of time overseas working and teaching. But my usual time, particularly the first few years, I'd have office hours in the morning, 5 days a week usually. I'd have surgery, hopefully as many afternoons as I could get, and every other night and every other weekend. There's a doctor that wanted me to work with him who played a lot of golf. And he said, I've got something you need, you've got something I need. And I said, what's that? He said, I've got too many patients and I'll get you some patients, and I like to play golf. And we just kind of swapped even. In those days, we delivered patients for each other. We went to each other's office on vacations and saw them. There was never an exchange of fees at all. It was just we helped each other. They had an excellent medical library. If you ever needed information, not that you couldn't get it at one of the other hospital libraries, but I don't know, I always went there. It seemed to work best. If I was interested in a particular disease or a treatment, I could ask somebody to look something up, and within minutes, they'd have it all looked up. In later years, they'd fax you a copy of the information. But it works well now. I called up at 9 o'clock this morning about several diseases I wanted some information on, and on my way walking over here early this afternoon, I stopped by and picked up about 6 articles for the literature that have been scanned, all copies in an envelope just waiting for me. That's wonderful service. We've also developed a history committee here, which I've been pleased to be a part of for many years, collecting old medical books, old instruments, to set up some of the history of medicine, which is very exciting, interesting, and informative. I can think of nothing I could have done in my whole life that would have made me more happier and enjoyed what I've done than medicine. Medicine has been wonderful. I mean, it's been good to me, but I've enjoyed what I've been able to do, where I've been able to go. I've been able to do things in medicine I never, ever could have done anywhere else. I think medicine is the most wonderful profession in the world.